Hello, I'm Dr. Nunez. Can diabetes be reversed through changes in lifestyle? These series of videos are about how lifestyle changes, things you can control, choices you make in how you live your life can improve your health and well-being. If you enjoy them and are interested in more of these, please click subscribe below and click the little thumbs up and the bell. Now, getting back into the diabetes. The short answer, if there's type 2 diabetes in an overweight person, yes, it seems like diabetes is particularly amenable to changes in lifestyle. I'm linking down below to a fairly famous study, the Newcastle Study is what it's called in the UK, where they demonstrated how calorie restriction and reducing weight in a diabetic, in a type 2 diabetic, can put diabetes into remission and stay there if they maintain their weight, so that the person can even come off of their medicines if they were on them. Now, this implies a lot of good things too. It implies prevention of type 2 diabetes as you age and people that are susceptible to type 2 diabetes. This is things that you can do that you have control of so that you don't have to depend on medications, pharmaceuticals, and all these other things. There's nothing wrong with them. If you do need help with medication, you should feel that you shouldn't feel bad about using those things. Now, implementing these kinds of changes, if you are already diabetic, is best done through the supervision from a physician. So you should discuss these kinds of things with your doctor or your endocrinologist on how best to approach it and how best to manage it. Now, in the study, they took diabetics, type 2 diabetics. This is a specific kind of diabetes. It's a very common kind of diabetes. And they showed in these that are overweight, over 200 pounds, that if they lost about 30 pounds, in the study they used metric, so it's 30 kilograms, in a short period of time through calorie restriction, they could reduce the amount of fat that's deposited in the liver and the pancreas and some of the organs, and they can restore the function of some of the pancreatic cells that produce insulin, and the person can come off of medication. And in so doing, if they maintain that weight loss and they maintain certain nutritional guidelines, they can achieve what's called remission from diabetes. So they're technically coming off of being diabetic, coming off of their medication, and maintaining a healthy lifestyle. This is a good example of what is possible through lifestyle change. They did very simple changes to restrict the calorie intake over a few weeks for that person and get them to reduce the weight fairly quickly. So that kind of regime does require, probably for safety, the supervision from healthcare practitioners, doctors, endocrinologists, specialists, this kind of thing. But once that's done, the person can really maintain themselves if they adopt the healthy lifestyle. Now, how do you keep, once you've achieved your goal and you're down? Yes, you can go into the plant-based diet program where the nutrition from especially vegetables can be very low in calorie density and can be very filling too. So it may help you in the long term to maintain that weight loss. The other component is motivation. Obviously, if you're diabetic or if you're down the path of perhaps developing diabetes, that could be a powerful motivator if you don't want to have to be on that, going down that path, and you want to take control and feel like maybe what you do can affect your health and your sense of well-being. So the plant-based diet can be a component of this. It doesn't mean you have to be vegan. The program that they put people on in the Newcastle study is not vegan dependent or anything anything like that. But it does mean that you have to be careful in the long term that you are making the right nutritional choices. And a whole food plant-based diet can be a big component in keeping the weight off so that you don't revert back to an area where you can fall into diabetes again. The other big component to keeping it off and maintenance is how you feel about what you're doing, that you feel positive, that you get that positive feedback, that perhaps you've improved your health and your well-being, you've come off of certain medicines, you're no longer diagnosed with a particular illness, and that can be a potent motivator for you. And again, what you're doing is you're moving from positivity, from a sense that, yes, I'm okay with who I am, I accept who I am, and I'm doing these things to improve certain aspects that I want to improve. So these are large components here that can contribute to improvement, which is the nutritional side, the weight control side. The other component is your physical activity. If you're going out and exercising and building that into your daily routine, sometimes just as simple as walking every day, 10, 15 minutes, several times a day, or walking for longer stretches, half an hour, 45 minutes, an hour if you can. And then the kind of walking that you do, if you have access to the outdoors and the weather is good enough for you to be outside, that's a good idea to do that, to engage in nature a little bit, that it lifts the mood, that provides all sorts of other health benefits apart from emotional benefits, apart from the physical benefits to your body of doing exercise. So these little components and emotional components, whether it's nutrition, it's exercise, enjoying the outdoors, engaging in nature, are all components of lifestyle that can contribute to your being more healthy and you're feeling better, your sense of well-being. So I wanted to leave you with those things. Again, if you enjoy these kinds of videos and this information, please press subscribe, press the thumbs up, and press the little bell for notifications. I'm leaving the link below to that Newcastle study and some other interesting links about nutrition and lifestyle medicine. Thank you very much. I'll see you in the next video. Bye-bye.